Let's bring in now surgeon, writer, and public health expert, Dr. Atul Gawande. He's a professor at Harvard Medical School and a member of President-elect Joe Biden's transition team. Dr. Gawande, good to see you this morning. So before we get into what you all are doing on that transition team, let's just kind of set the stakes here from where you sit. Where are we in this crisis? We see the numbers on the screen, 248,000 deaths. We know cases are spiking. We know hospitals are overrun. We know we're heading into this deep fall and winter period that you all have been warning us about since back in March. So where are we right now?
Well, one thing to put into that mix is the recognition that this week we've had two incredible pieces of news that suggest we have a endpoint to this, right? So we have two vaccines that are suggested to be likely quite effective. That means we can see the light at the end of the tunnel. It's quite bright. By second quarter in spring and into the summer, general public could be seeing distribution of vaccine. That means that we have to come together as a country and get every American we can through the tunnel alive with these jobs intact. And that means a comprehensive national plan. We haven't had that, but that includes relief for those who are going to be in jobs that are these face-to-face jobs where people don't want to go into stores and other settings, don't want to go to the movies while the virus is rampant. And then we need masks, testing, and our preparations with therapeutics and vaccine distribution.
Unfortunately, we've established, as you know, over 9 months, there's not going to be a national plan, perhaps until you guys get in there on January the 20th. There's been so much talk, and we've been discussing it even this morning, that you all can't even get your transition started here. Is there anything you can do back channel? Are you talking to people at least to set yourselves up if you can't have this official transition because it's being blocked by President Trump and by the GSA, to really be ready on January 20th, the minute President Biden is sworn in?
As part of the advisory board advising the transition team, what I've already seen is that the transition team is ready to deal with whatever cards they are dealt come January 20. But there are basic lines of information that we can gather from outside, talking to outside stakeholders, whether it's the manufacturers of vaccines, the pharmacies, the suppliers of gloves and masks. But we don't have the core kinds of information that only comes from talking to the agencies themselves. What is the status of mask and glove supplies and other critical equipment? What are the stockpiles? What are the plans underway for vaccine distribution? What's going to be handed off? All of that can't wait.
Thanks for checking out MSNBC on YouTube, and make sure you subscribe to stay up to date on the day's biggest stories. And you can click on any of the videos around us to watch more from Morning Joe and MSNBC. Thanks so much for watching.